We wanted to get you together and share some information on how we're preparing for COVID-19, try to encourage some people to take this very seriously and answer some questions that you might have relative to what we're doing and the direction we're being given from the Alabama Department of Public Health, the CDC, and others who are helping guide how we take care of the populations we serve during this process. To start with, I'm going to reinforce what you've probably heard numerous times. The best way to keep this from spreading is separation and sanitation. Stay away from other people, wash your hands, sanitize your hands. I will say that over and over again. Separation and sanitation is the best defense we've got against keeping numerous people from getting this. I also have encouraged our organization, we're taking steps to limit gatherings of large people. I would encourage everybody in the community to take those same steps. There's no reason to get a large number of people in a room close together. Again, avoidance of other people is the best way to break the chain of people who are passing this on to one another. I will say that this morning we were notified by the Alabama Department of Public Health that there's now a confirmed case in the state of Alabama. That was in Montgomery County. At this time, we do not have a confirmed case in Huntsville or any of our other facilities. We have tested numerous people, including people yesterday, where we do not have the test results back. But at this time, we don't have a confirmed case in our facilities in North Alabama. I would like to say that in times like this, the rumor mill and social media can disseminate misinformation in a very quick way. I encourage people to look at our website. We're going to set a hot link up on our website so that we can pass information along to you every day about the status as we get it from the Alabama Department of Public Health, along with other links to credible agencies that can tell you how to deal with this and what's going on around the country. The link that we have will have hot links to those other links. It's up now. If you go on our website, huntsvillehospital.org, you should see a red banner across our website. Click on that and it'll take you to that information. We believe this information was co-developed with the Alabama Hospital Association so that every hospital in the state will get the same information and have the ability to put it on their websites. We would like for the hospitals to serve as a resource to communities that we serve. We would also like to make sure that we're getting out consistent information. I will get back to the rumor mill. I made a mistake last night of trying to respond to social media. I was up all night responding to social media, but there's just a lot of misinformation out there. So please use credible websites and use credible information as you make your decisions around how you take care of yourself and your loved ones during this process. Specifically, for our facilities here in North Alabama, we're implementing some measures to protect our patients and our staff. It is vital that we protect our staff. In a normal flu season, 95% of our staff get a flu shot. So we don't have to worry about our staff being homesick. They're there to take care of people. We don't have flu shots for this virus. So we got to take extra precautions to protect our staff, because if you need hospitalization, you need our staff there. We have limited visitation. We're asking people to limit visitation to patients. I would take that a step further and tell you, if you do not have to visit someone in a hospital, do not visit someone in a hospital. Many of our local nursing homes, and I applaud them because the people in nursing homes are the most vulnerable to this disease, have eliminated visitation, and I applaud them for doing that. I think that is a wise move. In hospitals, we haven't gone to that step yet. I'm not discounting that we won't go there. At this time, we're asking for people to use common sense and avoid visitations if at all possible. In addition to that, when you're here, you're going to see signs all over the place to sanitize your hand. We've got hand cleaner everywhere. If people need a mask, we have access to them. We had them out, but people were putting them in their pockets and walking away with them, so we had to start allocating them at the nursing stations. But we will make sure when people are here that they are reminded constantly to wash their hands and sanitize and still keep their distance. The last thing you want to do is walk into a room to visit a patient and hug somebody. You shouldn't ever do that. You certainly shouldn't do that in this particular time. I will say this, it's not a time to panic. We've all seen what's going on around the country. It seems to me like people are either panicking or they just ignored it. There seems to be no in between. It's not a time to panic. It's a time to be smart. If we're smart and we do what's being recommended, we'll be able to mitigate this, and we'll be able to handle the people that need a hospital. Also keep in mind, most people that get this don't need a hospital. Most people don't need to come to the hospital to be diagnosed for this. We're going to talk about that in a minute. We're going to talk about multiple options to get diagnosed for this in a very short period of time. The lab companies and others are gearing up to make this available to people. But again, the vast majority of people who get this go home, get sick, get over it, go back to work, and life goes on. We're trying to protect those most vulnerable people who this seems to have the most devastating impact on. So if you would, please be smart. Remember separation, sanitation. Use common sense, and we'll all get through this, and we'll be okay. So with that, I'm going to turn it over to Jeff Sams. He's the Chief Operating Officer of Huntsville Hospital Health System. He's going to get into some specifics that we're working on, and then we'll take questions if you have any. If you have any. All right, thank you.
Thank you, David. So, as David mentioned, we're taking steps, and this is throughout our system, to protect our staff. We have treated these communicable diseases for years. Our staff know how to handle these situations. They know how to protect themselves. So we can do that as long as we have the staff and the equipment to do so. So as David mentioned, the visitor limitations, the hand the hand sanitation. We've also stopped shadowers and observers and unnecessary sales personnel in the hospital. Basically, if you don't need to be in the hospital, we're not allowing you in. For our own staff, to protect each other, we've canceled all business travel for our staff. We're not having large meetings. I had a meeting this morning, and we use every other chair. The simple things, you think it can't happen to you, but I'm try to keep yourself 6 feet away from other people. Our protective equipment, we currently have an adequate supply of personal protective equipment for our staff, but we worry about it being overutilized. So we're managing that very carefully and trying to make sure we monitor and utilize that. David mentioned some of the testing options. So there's an effort underway being coordinated by the Hospital Association in coordination with the Department of Public Health to increase testing, make testing much more widely available. So the current effort is to have a capacity to be able to collect specimens in a safe and efficient manner. So if your personal physician wants you to be tested, there'd be somewhere you can go to have that specimen captured and then sent off to the state to be processed. So we're trying to get that established, and I think there'll be more details about that next week. It's a statewide effort, and there's a fair amount of coordination going on, but we hope that will be available. So if your doctor thinks you need to be tested, there'll be somewhere to go where you can even potentially do that over the phone and not have to go to their office. Capturing these specimens and handling them requires viral media that not just everyone has. So we have to make sure that process works well. Locally here in Huntsville, Tracy and the clinical team are exploring creating an additional, it's called a flu clinic or a fever clinic, that's specifically designed to help people who may not have a personal physician or may not feel comfortable going there. So this would be an urgent care type setting where you would see a physician or nurse practitioner be evaluated and treated and tested there on the spot. We're trying to set this up for a short term to give people an option that is not the emergency department for these lower acuity patients who may just need to see somebody and get tested. So we hope we have that available next week. We're trying some innovative things. We may even do some things in your car. If we don't need to bring you into hospital around other people, we're going to try not to. So we're working hard to stand that up and have an option that will help keep people out of the ER and give them an option to be treated. Another thing Tracy and Robert and our clinical teams have done, we have had surge capacity and pandemic plans for years, and we update them annually. So all those have been reviewed. We have counted our ventilators. We have counted our isolation rooms. We know what our capacity is. We've brainstormed how to work if we're short-staffed. I just want to assure the community that we've done all those things to be as ready as we can be to care for patients. Lastly, I wanted to comment a little bit about what I know about the availability of testing. So up until just the last day or two, testing in Alabama has been limited to the state lab. That is expanding pretty rapidly. Several of the private labs are already available to accept samples, so that is increasing availability. And that will, I think, expand rapidly next week. We hope in the hospital on our lab equipment, we're talking to our manufacturers, and we hope they will have testing available within a week or two. So we hope to be able to process these tests ourselves within a week or two. And I think options will get much better. So we'll see how that evolves. But I think testing will be available much more efficiently in the coming week. With that, I'd be happy to answer any questions, and I've got Dr. Chappell and Tracy here to help me with that.
Jeff, one thing that I just want to mention, I failed to say it, I had it in my notes, but we want to remind the public, if you have a little fever and you feel a little upset, you don't come to the emergency department. We can't inundate the emergency department with people who don't need to be in the emergency department. So, as Jeff mentioned, we're going to have a lot of other outlets to keep people out of the hospital and in other locations that are more convenient to them, but also protect those people who actually need the emergency department.
Yeah.
Again, most people that get this, the vast majority, they go home, they get sick, they get over it, and it's okay. And we want to make sure those people just know that they've got something and they get home immediately.
I think personally 3 or 4 things can be true at the same time. Most of us probably won't get this. Most of the people that do, as David said, will get well very quickly. And then there are some people who are going to get it and be very, very sick. And we know that from what we've seen in China, other countries, in Seattle. So we have to take it very seriously and make sure for those people that do get very, very sick, the rest of us do our job to prevent that, and that our healthcare systems are ready to respond, and we have ICU capacity and we don't get overwhelmed. So we're asking for help to keep that subset of our population who does get very sick, that we can take care of them.
Hi there, I'm Dallas Parker with WHNT News 19. Just going off of the fluidity of the contingency plan here, currently, can you answer the amount of open beds you have here, and where do you put patients if you happen to run out of space here at the hospital?
Without a specific number, we have adequate beds open to take care of patients now. Patients are always moving in and out of our system from the ICU to the floor and from other hospitals. We have plans where we can expand and have patients in different areas that are non-traditional, like our OR suites, our PACU, and our cath lab suite. So we have plans in place to ramp up to take care of these patients if we need to. David and Jeff both mentioned a very valid point, and I'll say it again, to make sure you're sanitizing your hands and you're separating yourself from others. What we don't want are people who are we call the walking well to come to our ERs. We want those people to first call your family physician to see what you need to do. If you don't have a family physician, go to urgent care center. If you can't get to urgent care center, the Alabama Department of Public Health on their website has 2 phone numbers they can call and get directions. So we want people to do those things. Call their family physician, go to urgent care center, or call the number that the Alabama Department of Public Health has put out there. We don't want to overrun our ERs and our healthcare system, so we can take care of that small subset of patients that really need us.
Sydney Martin with Channel 31. With this virus, I know the State Department of Health said it could take 24 to 72 hours to get results back. So if you guys had testing here, could that speed up that process?
I think it would. Currently, the testing we're getting back in the last few days from the state had been coming back in about 24 hours. If we're able to process the test, when we're able to process the test here at the hospital, I expect that to be down under, 3 or 4 hours. The processing time is actually manageable. It's a matter of getting the specimen collected and couriering it to the lab. So we eliminate all that travel time, and it just as capacity comes online, we'll get rid of bottlenecks. So I think we'll get test turnaround very quickly once we can do it here at Huntsville.
Can I add one?
How many people have been tested here locally?
I think we've sent something like 20 or 24 patients to the state, and all those have come back negative. Changes every day. I think we sent how many yesterday?
5 yesterday.
5 yesterday?
And have those come back yet, or?
They have. I don't believe they have.
But as far as it goes, so far, nobody hears.
Nobody here has tested positive.
No staff, no patients, no physicians have tested positive.
I might add one thing on the commercial testing. Any Any test that's done by a commercial, whether it's our lab or another vendor, if it becomes positive by the commercial vendor, it will have to go to the state for confirmation.
And you guys won't get that information until it comes back from the state.
We'll know
Just
the
to clarify.
if we do it or we use a commercial lab, we'll know the presumptive result, kind of that early result, and then it goes to the state for the confirmatory testing. Because this is a public health crisis, there are rules about reporting. That's why we get the good reporting, is because everybody's required to send this to the Department of Public Health, and they can consolidate and track it.
I think for the first 24 hours, if you come in and we're testing you, we tell you to do the same thing as if we thought you had it. We only release you from doing that if we get a negative response. So the 24 hours should not be impacting how we're treating those patients. We're telling you, go home, isolate, do these things. Remember, the treatment for this is to go home, drink plenty of fluids, do the things you normally do when you've got the flu and don't have. So it's not changing the treatment, that 24-hour period. But 24 hours from now, we can say, hey, you don't have it. You still may be sick, do what you were going to do, but you don't have it. But it really doesn't change how we treat those patients.
I'm Jenna Ram with WAFF 48 News. There's several states in the country that have dozens of people with confirmed cases. Is that because they have widespread testing available, that they're able to confirm more cases?
Yeah, I can't say. I think it's impossible to answer that question. I think the testing in Alabama has been adequate. I think the Public Health Department has done a great job trying to use the resources they have to take care of the state. So I can't answer what happened in another state.
Yeah, I'd be glad to speculate on that because you just,
Yeah.
so.
It just seemed like there have been like a shortage of tests or something like that.
We have a low
Yeah.
population density in Alabama. If you go to other places where it's more dense, if one person shows up and they have it, many other people are going to get it. So by luck of the draw, whoever's got it in Alabama, the person in Montgomery, was not around a bunch of people, or we'd have a lot more cases. So the fact that that's a fact that plays into it. I think another one is believe it or not, we kind of jumped on this early and told people, back up, start canceling meetings and do those things. We started early and we think others started early. So I think that helped. Doesn't mean we won't get a lot more, but I think it helped us to be later in the curve.
That was kind of my next question. You said testing is going to become more widespread. Do you think it's inevitable that more cases are going to start popping up as that testing is more widespreadly available?
I think as more testing, I think as more people get tested, you will find more cases because that's the nature of this. It's transmitted and other people get it. Yes, I think that's true. I don't necessarily think that the testing process so far has been an impediment to us knowing who has it.
Okay, and then just kind of along with the ER thing that you've already mentioned, calling 911, getting that ambulance transport for this disease, that puts our first responders at risk. Can you explain the importance of people, not doing that and taking the measures that you guys are putting in place to preserve your staff and first responders?
I want you to hear that from our chief medical officer. He's the doctor. Let him, because I think people really need